On this Monday night, reopening plans for Canada's two biggest provinces. Quebec sets a date, while Ontario has no timeline.
We aren't going to reopen everything at once.
What's planned to resume and what's still off limits? Where's the support for Canadian seniors? The push for answers from the Prime Minister can't catch a break.
And then here comes this flood.
From floods to fires, the new emergencies flaring up during this pandemic. Top secret images captured by U.S. Navy pilots.
Oh my gosh, dude.
Why the Pentagon is releasing these now, and what are those mysterious flying objects?
Global National with Donna Friesen.
Good evening and thanks for joining us. We begin with the baby steps being taken to reopen parts of the Canadian economy. After weeks of lockdown, Canadians are looking for some semblance of normal life. This is how Canada's public health officer put it.
These past weeks have made the words of millions of kids ring true as they shout from the back seat, "Are we there yet?" Though I'm sorry to say, no, not quite yet.
Prime Minister Justin Trudeau said again today things will not get back to even close to life as we knew it until there is a vaccine or an effective treatment. And he played down the idea that people who have had COVID-19 might get immunity passports.
There is no conclusive evidence right now that having contracted COVID-19 once protects you from contracting it again a few months later. This is too new a virus. Scientists are working very hard on exactly that, whether the presence of antibodies in someone will protect them from catching COVID-19 again. But we don't know that yet.
Ontario's premier laid out plans today to slowly, methodically begin to reopen some businesses and public spaces. It will happen in 3 stages in Ontario. Each will last 2 to 4 weeks and will be closely monitored. The first will involve opening some workplaces and allowing some small gatherings, but there is no time frame.
The framework is about how we're reopening, not when we're reopening. No one wants the economy to open up more than I do. But we can't take anything for granted. We can't take unnecessary risks.
Eric Sorensen explains Ontario's framework for the weeks and months ahead.
Ontario says it'll be ready to open the economy more widely the moment it's safe. Stage 1 will permit more businesses to have curbside pickup and delivery. Outdoor spaces like parks will ease restrictions, and hospitals will be able to offer elective yet serious surgeries that have been put off. If all goes well, after 2 to 4 weeks, bigger workplaces could open, with larger public gatherings allowed. But huge gatherings like concerts and major sports events will remain out for now. And there is no timetable yet.
Progress doesn't mean we can quit now. And that's why I won't set hard dates until we're ready.
Ontario will provide guidelines for workplaces to be ready to open.
This guidance will come as soon as it's available so that employers can start to make the plans that they need to make.
The reason for some confidence is the number of cases in Ontario has leveled off during April, an average of 460 new cases each day, an increase but not the doubling of cases we saw every few days in March.
What Ontario wants next is to see the number of cases coming down in the weeks ahead so it's safe to restart the economy.
The reason we're here where we're at this point of the flattening of the curve is because of each and every one of you. We'll get there, and we'll be rolling that out as soon as we see the consistency of the numbers dropping.
It's really going to be a really tricky balancing act, trying to open up enough to get things going, but not too much that we end up with a second wave of cases.
COVID-19 case numbers appear to be coming down just a bit in Ontario, but any return to normal has to protect the most vulnerable.
Right now, our biggest challenge is long-term care, and it may take us a couple weeks to start to see a decrease in those cases as well.
One other question mark for Ontario is schools. There are no plans to send any kids back to class before the end of May, leaving a small window in June still as a possibility. Eric Sorensen, Global News, Toronto.
Quebec is also making plans, and it is setting some target dates for reopening, even though it has the most cases and the most deaths from COVID-19 in Canada. Primary schools and daycares in Quebec will begin to reopen on May 11th, though attendance will not be mandatory, and high schools will remain closed until September. Mike Armstrong explains Quebec's strategy to phase that province back to a new normal.
With Quebec schools already shut down for 6 weeks and counting, many have argued to just leave them that way and open up in the fall. The problem with that thinking, the Premier says, is come September, we may be no further ahead.
There's no proof that we'll have a vaccine in 6 months, so we'll be in the same situation as today.
The plan is to have students return to classes in steps. For now, it'll only be daycares and elementary schools. For most of the province, classes will reopen May 11th. For the Montreal region, where most of the COVID-19 cases are, it'll be May 19th. The goal is to keep classes to about 15 students and to ask them to keep 2 meters of distance between each other. The situation will be monitored closely. If there are outbreaks, students and staff would be tested.
Based on the situation and the specific story, that class could be closed for 14 days.
Staying at home means saving lives.
Now, the number of cases of COVID-19 is still growing in Quebec. The government says it understands some parents will be nervous sending kids back to school when it feels like most of society is still shut down. Well, attendance will be optional. Cecily Ranger had hoped not to send her daughter back to school until the fall.
I'm not worried so much about her health. I'm more worried that if the kids are carriers, that they're going to get other people.
Quebec's Order of Pediatricians has pushed the province to reopen schools. It says children with developmental delays or psychological issues need contact with teachers. Also, according to experts, children are less likely than adults to contract COVID-19, and if they do, much less likely to have problems.
If we don't do it now, we cannot keep the kids inside forever.
Now, opening schools comes as Quebec continues to struggle with outbreaks in seniors' residences. 400 soldiers hit the ground this coming Wednesday to help with that crisis. But the province says the healthcare system overall is doing well and could cope if there's a problem. Mike Armstrong, Global News, Montreal.
Here's why Canada and other countries are treading so carefully when it comes to reopening. The pandemic is still far from under control. Today, it hit another grim milestone. The number of confirmed cases worldwide has now surpassed 3 million. More than 210,000 people are known to have died. In Canada, more than 1,600 new cases were reported today. A number of provinces, though, did record no new cases today. Ontario, Quebec, and Alberta, though, are still seeing big daily increases. More than 48,000 people in Canada have now tested positive, and more than 2,700 people are known to have died. This was the first day businesses could apply for the Canada Emergency Wage Subsidy, and roughly 30,000 businesses signed up in the first few hours. The subsidy covers 75% of wages for employers who have seen a drop in revenues because of COVID-19. Eligible companies can receive up to $847 per employee per week for up to 12 weeks. The benefit, which is retroactive to March 15th, is designed to help businesses rehire laid-off workers and keep people on the payroll. The Prime Minister is warning workers they cannot dip into 2 federal financial programs at once.
If your employer can't hire you back, if you're a seasonal worker, if you can't find a job right now, the Canada Emergency Response Benefit is there for you. And I want to remind everyone, you won't be able to keep both the wage subsidy and the CERB. It's one or the other, not both.
The Prime Minister says the money should start flowing May 7th, but it could take longer for those who don't have direct deposit set up. Well, we know our elders are the most vulnerable to COVID-19. More than half the deaths in this country have occurred in long-term care homes. The federal government is contributing $9 million through United Way to support services for seniors, but we've heard from some seniors, especially those on fixed incomes, who say it's not enough. Our Ottawa Bureau Chief, Mercedes Stephenson, is looking into this. Mercedes, the Prime Minister was pressed again today about this. What did he say?
Well, Donna, he's been asked about this a number of times, and the government highlights the benefit that they have provided, that United Way money you mentioned, as well as a one-time GST credit for seniors. But many seniors out there say that's not enough. So we asked the Prime Minister what more he has planned and when it might come. This is the answer we got.
As I said, we're looking at things like supports for the most vulnerable seniors who are seeing extra costs because of COVID-19, and we will keep working on that and have more to say soon.
Now, Donna, the concern is that a number of seniors have seen their costs increase. Things like getting groceries delivered to them or having to take taxis because they're vulnerable to this bug, and being on public transport could be dangerous. Another big source of increased expenses, medications. We spoke with Bill Van Gorder. He's one senior who has seen that happen.
In most cases, seniors are having to pay for extra prescriptions because there's been a limit of 30 days put on drug prescriptions, so that dispensing fees have to be paid 3 times over a 3-month period instead of just once.
Donna, 1.6 million Canadian seniors live on government programs, things like OAS, the Guaranteed Income Supplement, and CPP. Their income can be as low as $16,000 to $20,000 a year, so they are seen as particularly vulnerable, and we're waiting to see if the government will do more, in particular for that group of seniors.
Okay, Mercedes Stephenson in Ottawa, thanks. There is talk of quarantine fatigue in the U.S., though it remains the epicenter of the outbreak. The U.S. has the most cases of COVID-19 and the most deaths. Yet, as Jackson Proskow explains, 1/3 of states are beginning to relax or even end stay-at-home orders.
On the first day back in Georgia, business is not exactly booming.
We're trying to stagger our clients and not just load them in here so there's not so many people in here at one time.
There are few willing to risk it for a haircut or a meal. Movie theaters can reopen. Most are staying closed. There's no point when there are no new releases.
I have 10 employees who are relying on me in this theater for their livelihood, but I'm not going to try and make them choose between their livelihood and their lives.
That's not the case in parts of Texas.
We wanted chips and queso on the patio.
Where the mayor of Colleyville allowed patios to reopen over the weekend, there was a 3-hour wait for a seat.
They're sanitizing, they're wiping down, they're not giving anyone someone else's stuff.
Even hard-hit New York is considering a plan to lift restrictions in rural areas by mid-May. Health experts have warned it's likely too much too soon.
What happens if we dial back these social distancing measures, but then have to dial it up again?
Not one state has met reopening guidelines laid out by the Centers for Disease Control. The number of daily infections and deaths remains stubbornly high, and testing rates too low.
And in fact, there may be many waves of infections.
The fear seems to be what happens if the U.S. doesn't at least try to get back to business. White House economic advisors have warned the unemployment rate could rise to levels not seen since the Great Depression. Jackson Proskow, Global News, Washington.
There are new concerns emerging in the UK about how COVID-19 may affect some children. The NHS, Britain's National Health Service, has issued an alert to doctors warning there have been a small number of cases of children presenting with a multi-system inflammatory state that requires intensive care. The symptoms can include fever, abdominal pain, heart inflammation, and skin rashes. Some, but not all of the children have tested positive for COVID-19. It appears to be a form of toxic shock syndrome. It's not clear if a new COVID-19 syndrome is emerging in children in the UK or if it's an as-yet unidentified infectious pathogen. Having survived a serious case of COVID-19 himself, British Prime Minister Boris Johnson was back at work today. He'd been in intensive care and came home from the hospital 2 weeks ago. Johnson today urged people not to lose patience with the lockdown, saying this is a time of maximum risk, but that the UK is beginning to turn the tide. He said plans on how to ease restrictions will be released in the coming days.
If this virus were a physical assailant, an unexpected and invisible mugger, which I can tell you from personal experience it is, then this is the moment when we have begun together to wrestle it to the floor.
There is no widespread undetected community transmission in New Zealand. We have won that battle, but we must remain vigilant if we're to keep it that way. That includes safely returning more New Zealanders to work, enabling more businesses to reopen, and allowing some of the recreational activities we've missed in the past 4 weeks.
That's New Zealand's Prime Minister Jacinda Ardern. She imposed some of the strictest lockdown measures of any country in late March, closing schools, non-essential workplaces, and banning social gatherings. The country has just 1,500 confirmed cases and 19 deaths, and there have been only a handful of new cases in the past few days. So some restrictions on non-essential businesses, healthcare, and education are easing, but physical distancing continues, and people must remain in their social bubbles. Ardern is considering expanding that bubble to create a travel corridor with Australia, New Zealand's biggest tourism market. The rate of infection is slowing in Australia, too. It has just over 6,700 cases and 83 deaths. Australia's government was swift to close its borders and beaches and ban cruise ships. Spain is taking another step to ease some of its strict lockdown measures. Children under 14 are getting their first taste of freedom in 6 weeks, and police are using a drone to monitor public spaces. Children have been granted 1 hour of daily supervised outdoor activity. They must practice social distancing and stay within 1 kilometer of their homes. It's been 1 week since Constable Heidi Stephenson died. Coming up, the campaign to honor the Mountie killed in the line of duty.
There's so much information surrounding coronavirus out there now. We know you have questions. Email your questions at globalnews.ca. Tune in to Global National or go to globalnews.ca/coronavirus now to find the answers.
Nova Scotians are searching for ways to heal after the murders of 22 people. The grieving period is being made even more difficult because of physical distancing, and people are also looking for answers from the complex investigation that's underway. Ross Lord reports.
Mounties who responded to the massacre and those serving in its aftermath are not speaking publicly, but former frontline officers have no doubt about what their colleagues experienced.
Absolute chaos.
28-year veteran Rob Creaser has long advocated for RCMP members. Creaser agrees with calls for a public inquiry to untangle the chaos, using the authority to call witnesses.
Rather than just the police having access to those people during their investigation, they would be possibly called to testify at a public inquiry where their statements would be available for all the public to hear.
He says there might never be an answer to why the gunman massacred 22 people dressed as a Mountie driving a fake RCMP cruiser. The Nova Scotia government is considering outside reviews, including a closer look at why the RCMP relied on Twitter messaging instead of issuing an emergency alert.
Trust is essential, and confidence in their ability to do their jobs is absolutely essential as well.
As victims' friends and families grieve, each day brings new ideas for honoring those killed. There's an online petition calling for a Dartmouth High School named after Prince Andrew to be renamed in honor of Constable Heidi Stephenson. The 23-year veteran of the force and mother of two is remembered as an exemplary officer as she was killed while trying to stop the gunman. In Portapic, where 13 of the victims were killed, Nova Scotia RCMP say they'll keep control of crime scenes for several more days. Other investigations are underway. The Serious Incident Response Team, or CIRT, is examining part of the Mounties' response, including the discharge of firearms involving two members that left holes in a fire hall, a location where the gunman did not visit. The director of CIRT says there's no way of predicting how long investigators will take to file their reports, because the agency has never investigated anything like this. Ross Lord, Global News, Halifax.
Ahead, first a virus, now floods and fires. In Fort McMurray, Alberta, floodwaters are now forcing many people to abandon where they live. As Heather Urix West reports, they're hoping another fierce forest fire season isn't the next emergency they'll face.
The streets of Fort McMurray, Alberta, under water. The water from ice-jammed rivers rose too quickly for Joseph Vergara to get out of town in his van.
They took me on the boat, and that's when I took the video, and it was just mind-blowing.
Next week, Fort McMurray marks just 4 years since wildfire tore through this community. Now it's dealing with assaults, it seems, from all sides.
Now we have to try to find a new normal with this coronavirus. While that's happening, our oil prices have gone into the negative, and then here comes this flood.
We can't control Mother Nature, but we can control our reaction to it. We're going to, to respond to this effectively.
There are physical distancing measures in place at evacuation centers. Anyone without a place to go is being put up in a hotel. But with much of the city now under a boil water advisory, the local government has asked the military for help.
We are aware of the flooding in Fort McMurray and are looking right now very urgently at ways that we can help.
Spring brings an increased risk of both floods and wildfires, pandemic or not.
It definitely is playing into our preparations for the fire season, and we've been working on a number of initiatives.
Because of travel restrictions, crews in BC and Alberta may not be able to count on additional crews flying in to help if the wildfire season turns bad. It's why both provinces are doing all they can to prevent fires from starting. 60% of Alberta is under a total fire ban. And Verga is now isolating in another part of town with friends, riding out the latest crisis with hope that, like the fires of 2016, this too will pass. Heather Urex West, Global News, Calgary.
Coronavirus zombies next, the strange tactic to keep people safe. Well, this is one way to get people to stay home. Police in New Delhi are dressing in helmets shaped like the coronavirus and walking through the streets. India imposed a lockdown on its 1.3 billion people last month to stop the spread of COVID-19. There are about 30,000 confirmed cases in that country. And in the middle of a pandemic, why not toss in some unidentified flying objects? The Pentagon has declassified 3 short Navy videos.
Look at that thing. It's rotating.
The official description is unidentified aerial phenomena. U.S. Navy pilots captured these images in 2004 and 2015. They've been leaked before, and one of the pilots told reporters in 2017 that he believed what he saw was not from this world. The Pentagon decided to officially release them now to clear up any misconceptions about whether the footage is real. So we know the videos are real. We just have no idea what those objects are. And that is Global National for this Monday. I'm Donna Friesen. Thanks for watching. Take care of yourselves. Bye-bye.